Hola, amiga, and welcome back to the Latina Leadership Podcast, the podcast for Latinas by Latinas, where every week we have real conversations about the issues and topics that matter most to our community. Topics like education, health and wellness, entrepreneurship, pay equity, and so much more. Get comfortable. We're bringing you another inspiring episode starting right now. Enjoy the show.
Hola, and welcome to another episode of the Latina Leadership Podcast. I am your host, Anjelica, and on today's episode, I have Stephanie Ramirez with Legacy Community Health. Stephanie, I give every interviewee an opportunity to say who they are and what you do. So Stephanie, who are you and what do you do?
Good morning, and thank you for having me on the podcast today. I am both honored and blessed to be able to be here with you today. As you had mentioned, my name is Stephanie Ramirez, and I am the Vice President of Operations for Legacy Community's School-Based Health Clinic program. To tell you just a little bit about the program, we have 37 schools throughout the greater Houston area, and we partner with KIPP, Yes Prep, and Galena Park Independent School District. And I have been with Legacy will be 2 years in January. Took a little bit of a journey to get here, but have been in healthcare for over 15 plus years and have served as a city councilwoman for a little city of South Houston at the age of 23, and that's a whole different story for a whole nother day. But it's been a great experience, and coming to Legacy and being able to serve a community with an organization like Legacy Community Health is truly an honor and a privilege.
So just really quick, so the program, you're within some of the high schools. What does that mean? Like what does Legacy do within those schools or that school system?
So we are in elementary, middle, and high schools. We have 2 charter partners that we are with in the Galena Park Independent School District. That is the only school district at this time. What we do is we have clinics located inside of the schools. We provide pediatric services as well as behavioral health or therapy services for not only the students who attend that school, but their siblings as well as the children of the staff who work in those schools. And what that means is that if a student gets sick while they're in class, they will go see the school nurse. And if it is something that the school nurse cannot take care of because it's beyond her scope of practice, then they will come to the clinic, and we have nurse clinicians as well as medical assistants located inside the school. And they can do all types of testing for STDs, flu, COVID, and address their issue at that time. And then they will reach out. So we reach out to the parent before and after. So the parent does not have to leave work for their child to see and get the medical attention that they need. So it provides a great convenience because where we are at throughout the greater city of Houston are underserved communities. And so a lot of times parents may not be working close to home. They may be working hourly jobs. And, a lot of times it's, do I take off of work to take my child to the doctor, or do I go to work and let my child stay home, not knowing if it's something that needs immediate attention or not? And so we are able to take care of the patient. And again, we take care of their siblings as well. So for the beginning of the school year, if they need vaccines, the entire family can come and get their vaccines in one location. On the behavioral health side, if there are students who are feeling anxious or who may be nervous about coming to a new school, or who are being bullied or having some self-confidence issues, they meet with their school counselor, and then their school counselor will connect with one of our therapists who are also inside the schools. So it's convenient care so that we make sure that the student and their siblings are feeling good and they're feeling confident about themselves, and the parents don't have to leave work, and we have open communication with them. So if we do testing and we find something, we'll call the parent and say, here's what the outcome is, and we will be able to call in a prescription at a pharmacy near your home. So it's really convenient for parents and families, and our goal is to help students feel good about themselves.
Mm-hmm.
In Galena Park, we recently added dental services.
Mm-hmm.
So we're opening it up to the community. So anyone from the age of 0 to 18, if you're a student up to 21, but you can receive dental services. And all of our pediatric, behavioral, and dental services are offered to anyone and everyone in the community.
Mm-hmm.
Uh, they are not a free service, but we are able to provide care at a reduced cost and
Mm-hmm.
also get families connected with resources. So if they don't have insurance coverage, and they don't know if they qualify or not, we have a team at Legacy Community Health that will help them submit the proper paperwork, let them know if they qualify for something, and if not, then we have a discounted rate that's offered to them. But we will see any and everyone who comes to either our school-based health clinic or one of our 24 community clinics.
For those who are listening, I don't think they understand what that actually means for a community like Galena Park. I'm very familiar with Galena Park. It is a
Mhm.
small community, correct? But it is an underserved community. And it's
Yeah,
so, even though it's within Houston proper, it is so, how would I say this? It's so disconnected
it's
from a
remote.
lot. Yeah, it's disconnected
Yeah,
from a lot of just the port of Houston on one side. I mean, the port on one side. You have another one that's the intersects of where, like, of course, it's a major highway, and then a major highway on the other side. Side of that, there's a levee first before you get into Jacinto City for the other community. And on this side, it's the same thing. It's refineries, right?
yes,
So it's completely blocked in from a lot of. Again, it's like its own little island within an island within a
right,
land, and
right.
so to be able to provide so many services directly to the school, because that's where the community is at, right? That's where
Yes,
they go to school. That's where they congregate. That's where they have conversations. It's the be all do all. I mean, they have a huge, to say this, right? Such a tiny community, but then they have a huge impact when it comes to, like, what is it called? Their band, right? Their school band. They're all for
yeah,
it. And so they know that as a community, they really they flourish together. And
yes,
so understanding and knowing what Legacy is able to provide them, right, outside of
right.
all the amazing amenities that Legacy, I know Legacy well. It's among the Houston community. I've never seen a Legacy clinic, right? But now I
Yeah,
understand that y'all are serving Galena Park in a whole different way, in a whole different manner, to be able to really make an impact to Galena Park. Um,
yeah,
so I'm thrilled to hear that y'all identified it as an opportunity to be able to truly make a positive impact, especially.
yeah. And I
Go
Yeah,
ahead.
and I think that's where how most. So when we look at schools, we look at it with intention,
Hmm.
right? Are there an appropriate number of clinics available or healthcare available to students? There's another independent school district not too far from Galena Park
Hmm.
that has limited, like you said, there's I-10, there's 225, there's the Fred Hart, like all of these areas. But when you look around, as I'm driving around there, you look to see, are there medical offices? Are there dental offices? Are there those services available to them? And when you see that there aren't,
Hmm.
and when the schools reach out to us, that's what we look for, right? We look for areas that don't have easy access. Not everybody can come to the medical center. Not everyone can go to Clear Lake. While there are a lot of clinics around the greater Houston area, um, our community that we serve is a very unique community and a community of need. And so we feel very honored that we get to interact and help not only the patients, but their families as well.
In a very positive, yeah, I agree. I definitely agree. So Legacy as a whole, as not an institution, as a clinic, as a big clinic, it's one of the major clinics there in Houston.
Mhm.
The community you serve, can you tell us, typically, not typically, I've seen the Montrose clinic, I've seen the
Mhm.
clinic. I actually, my gynecologist, when I couldn't find one, she was at Legacy. off of Leland. No, it was off of. Well, this was like 2 years ago. I remember that's where I find my gynecologist, and I was like, "This is like I have to go to a community clinic for me to find a gynecologist, right?" Like I
Yeah.
was like, "This is," and my clinic was somewhere. Anyway, long story short, amazing physicians that you have there. But legacy as a whole, when you serve the community, the underrepresented community, can you talk to me a little bit about who and what and how that sounds like, without, of course, giving too much indication or kind of ousting them to say,
The community that we serve,
yeah.
we provide primary care and we have
Mm,
specialty, right? Um, Legacy started as in one small building for the HIV community,
mhm,
right? And it it has just grown in leaps and bounds and has advanced to, like you said, there's gynecology, there's primary care, there's behavioral health. There, we have, other, our school-based health. We have just infectious disease,
mhm,
physicians. So it's a whole patchment. It's looking at the individual as a whole, right? You come in and you have a cold. Well, it could be something else, right? So Legacy, I think, does a really good job of not only taking care of the immediate need, but looking at the individual as a whole throughout the greater Houston area. And when we say that we are in underserved areas, it's areas, like I had mentioned before, that don't have easy access
mhm,
to healthcare. It's a community that may not have commercial insurance. It's a community that, you know, people have migrated in from other countries, and they're living to work. And, so they may not be able to have the luxuries or the um, the benefits that we do as individuals who have worked here, who have
mhm.
lived here, have those opportunities to have insurance and to be able to pay for things. Um, we're in communities where we want to help the population, like I said, get connected to resources that they may be eligible for with regard to insurance,
Yeah.
or just to get them connected to healthcare, period,
Mhm.
right? And let them know that, yeah, you may not have all the amenities that other people have. You may not have the financial resources that other people have, but we are still here to serve and to take care of you and to help you in a way that is beneficial both to you and to Legacy as a whole.
Yes. And I like the way you mentioned really quickly, just because, again, I'm familiar with legacy. I am. My gynecologist was there. So when you mention legacy as a whole, there are some clinics that are tiny clinics, but they always, like if there's a bigger problem or issue, they always refer people out to like a regular doctor and it's
Yeah,
not within the clinic itself.
right.
Legacy refers to if there's a specialist that needs to be seen, it's within the clinic itself. So the patient doesn't have to go like venturing out again to go look for somebody and delaying the issue at hand that might be affecting them in the moment, to
Right.
be able to. And so when you say legacy as a clinic as a whole, I know people don't maybe I didn't, because I didn't understand that it kind of works. It's not a hospital, but it works like, you know what I mean? Like,
It's like a system, and
yes.
it's a community within a community.
Yes.
So
Thank you.
and like our students, right? So
Hmm.
if they're graduating, we have something called the senior checkout program. And so
Hmm.
for seniors, we get them prepared for the next stage in life. So we make sure they have vaccines, how to get connected with the pharmacy, how to get connected with the primary care physician. And for those who may not be leaving the greater Houston area, it's a way to get them connected to a legacy clinic. So there is that continuity of care, right?
Hmm.
We're like a family, whether we're school-based health or a community or a specialist or what have you. If we provide the service, we're going to see you initially and then get you connected to that service within our community that is convenient, at a location that is convenient for you.
Yeah.
And a lot of the families of our students, right, when they bring their child in or we call them, we tell them about our 24 other clinics because they may not know that they can also be seen somewhere close to where they live and they don't have to drive 30 minutes down 225 or I-10 or 610 to get health care.
Mm-hmm.
The legacy as a whole is growing, and it has grown and evolved. We're even out in Beaumont, right? So there's healthcare in Beaumont and behavioral health services in Beaumont. And so I think Legacy's mission and vision for taking care of the community is one that is strong, and that is something that we build on.
Mm-hmm. You know, I can go on and on about legacy because I'm familiar with it. And I really, really, the fact that I just went to go see a doctor because I couldn't figure it out. My doctor wasn't there and I just needed to see a doctor. And they're like, hey, we have gynecologists, like, and they're pretty good here. I was like, okay, we'll see. Because I had
Yeah,
a really bad experience with my gynecologist within the clinic that I was going to. And I was
yeah,
like, oh, okay, well, let's see. And sure enough, she was amazing and wonderful and offering and doing, and I was like, oh my god, I'm getting service. This
yeah,
is what they mean when they're serving the community. They understand.
yeah,
This is what I needed. I didn't need somebody to tell me, uh, you're fine. It's like, oh, but how do you know I'm fine? You're not feeling what I'm feeling. You're not experiencing what I'm experiencing. I'm telling you what I'm experiencing. You're looking at me and seeing my age and like, you're just complaining. And I was
yeah,
like, but when I seen her, I just fell in love with the entire concept of what legacy, and of course that's what I do. I go and I start digging, what else does legacy do? And it was the behavioral sciences, right? The
yeah,
behavioral clinics. And I was like, oh. So of course I started to venture in to see if they had available a therapist for myself, right? Because they're in the Houston area. And so anyway, I say
yeah.
all of that.
Mental health, the stigma of mental health, right,
Uh-huh.
is especially within our community,
Yeah.
right? Because we didn't talk about mental health. If we didn't get mental health, we didn't seek mental health because that was just the thing we didn't do.
Yeah.
But it has evolved, and people have made, we bring it to light and we say it's okay to see a therapist because
Mhm.
sometimes we can't figure life out ourselves. And I think what you will find is the team that is at Legacy is very passionate about what they do.
Mhm.
There's people who come and then people who go, but the people who remain are truly invested in
Mhm.
helping our patients. And I left the job of 9 years at a great organization, and I was comfortable, and I ventured out and I said, you know what, this has meaning, this has purpose. Not that my last job didn't, because it did. It just, you look for that something more as you begin to age in life.
Yeah.
Um, and being able to be a part of something like this is fulfilling, right? And
Yeah.
it's giving back. And I think it's helping the community that otherwise wouldn't feel comfortable getting healthcare, bringing them to that level of comfort
Mhm.
where we empathize with them, we listen to them, and we say, hey, we understand you're scared, or this may not be common to you, but we're going to help you get through it.
Yeah.
And that is the beauty of what Legacy does.
I love it. I love it. Again, when I went to the clinic, I remember they pulled me aside. They're like, and I think it was in terms of like food disparity or something. They're like, how are you eating habits? And I was like, I'm okay. But that was the first time I ever experienced that. I was like, I wish this was like this when I remember being 8, even
Yeah,
15, going to the clinic, and it was a City of Houston clinic. I don't remember. It was Denver Harbor Fifth Ward. It was the
yeah,
clinic that was there. And, but we never got asked, it was just what we went for, there to get my shot or there to, whatever. There was never like a wraparound service. There
yeah,
was never like, what do you need? It was more like, okay, we're going to attend to you and bye.
yeah.
See
Here's your
you.
shot. See you later. Not how are you
Yeah.
doing? How are you feeling? Like your visits were, 15 minutes
Yeah.
in, you're in and out, and you're gone.
Yeah.
Uh, yeah.
So I,
So
I appreciated that a lot. And I very much appreciated that, that Legacy understands. and they know and they see that the community they're in, without embarrassing anybody, without whatever it may be, it's just,
Yeah.
it should be what it should be, offering the help without being like, oh, you're in need. Well, okay, well, don't embarrass me. Like,
Yeah.
no, I'm in need. That's why I'm here. But don't make it so like I'm, kind of like pobrecita. Like, just
Yeah.
give me, just, I'm here because I have to be here. Just help me, please, without judging me. That'd be
And
great.
I think an exciting part to school-based health is that we are part of two grants. One is
Mm.
one that you mentioned, food insecurities. So we are partnering with one of our local partners in medical care, and we are going to be asking students in the Galena Park area about their food insecurities and their habits. And if there's a student who's maybe struggling with obesity or weight management, this program is going to offer fresh produce to those families who are willing to participate. And instead of them having to come pick it up somewhere, we're going to deliver it via DoorDash. And another grant on a national level that we're working on is getting care coordinators. So we are, though these care coordinators are going to be responsible for helping students and families get connected to other resources, whether it's, housing or transportation or food, access to healthy food. It's so being a part of this national organization partnership is allowing us to provide even more service to students and their families who may otherwise not feel comfortable getting it or knowing how to access it, right? Because for us, they're like, here, call the specialist and make an appointment.
Yeah.
For somebody who's not used to that or is not comfortable doing that, right?
Yeah.
What is the possibility of them, the percentage of them that actually follow up, because they're, oh, we don't need that. We don't need to take care of that. And then 4 or 5 months down the road, it comes back, but it's even worse. So prevention and maintenance and like you said, helping people feel comfortable without judgment, right, is
Yeah.
the biggest, you know,
Yeah.
blessing that legacy offers.
As you were talking, Stephanie, I hope you don't mind me sharing the realization I just had, because my heart dropped, is that students in high school, and I understand now why, a lot of them don't seek higher education, or they don't seek kind of going to get like maybe a certification or a trade job, because they go directly from security of having routine and access to food, right? Because they get free lunches.
Mm-hmm.
And when they graduate, that's it. There's no more routine. There's no more free lunch. There's no more, and you're kind of thrown to the real world, so to speak.
Yeah.
And you think, you're like, oh, oh, this is how they end up in situations and in the same cycles over and over, because now they have to, when there was never, they were just trying to struggle to get to school. And now there's this huge expectation to these kids, who are 18 years old and 17 years old at times, to like fend for themselves and do what you got to do. And yes, responsibility is amazing. And yes, all of this. But when they come from a place of already necessity and need, and then they graduate and we all celebrate, but then it's like, okay, then what?
Yeah.
Yeah. And the
Yeah.
fact that legacy understands, and the continuity of getting them to like, okay, you're graduating out, you need to continue seeing the doctor. There's food disparity. Well, how do we get you to where you need to go and to be, so you can continue down the path seeking higher education or getting a trade, so like that you can provide for yourself, take care of
Yes.
you, and then you decide what you want to do from there. And I just wanted to share that, Stephanie. I'm so sorry, because it just dawned.
No, it is interesting that you say that though, because even from me growing up in a household where there was, it was an upper middle class, there was structure, there was all of this. Even upon graduation, right? In my head, I knew what I wanted to do, but I didn't know how to get there. And so for life, it's not always a straight path, and sometimes we have to figure things out. But
Mhm.
I at least had a foundation of seeing my parents work. And I'm very proud to say that I am the first generation to graduate in both sides from my mother and father's family with an advanced degree. But to your point, how many graduating students really do that, right?
Mm-hmm.
And I know in the charter schools, they prepare them for that.
Yeah.
In independent school districts, they try to prepare them for that. But sometimes it's a matter of, do I go to work to help my family or do I go to school?
Mm-hmm.
And I think what young people need to understand is you can do both.
Mm-hmm.
You can be successful. There's nothing wrong with going to a trade school. There's nothing wrong with going to a junior college. You know, you're making the effort to better yourself and to help your family and to be the example.
Mm-hmm.
And I'm glad that you touched on that because it resonated with me from a sense that how do we also help students get ready for the next phase in life
Mm-hmm.
as we're helping them get ready for their health care, right?
Mm-hmm.
As a part of the senior checkout process. What more can we do to help them prepare for what's next?
Yeah. Well, you know, legacy thinks and legacy does, and I like that. I very much, I very, you know, grateful for all of that. But aside from legacy, I want to talk to you, Stephanie, a little bit about who you are. What I do want to ask you is when in regards to like in regards to your, because you mentioned it quickly, in regards to your upbringing, you're from Houston. You're from the Houston area proper as a whole. What made you get into, yes, healthcare?
Um, Growing up, I grew up with my grandparents. At the age of 4, illness fell. My mom and dad had to work, and so I grew up. I was raised by my grandparents, and very fortunate that my mom and dad allowed that, right? Because a lot of you are no, they're my child. They're going to stay with me. So we fast forward. I think just being able to make a difference. I actually started as an executive assistant. Like
Uh-huh.
I was a secretary. But in my mind, like I said, I knew I wanted to either be a lawyer to help people, I wanted to go into social work. So I started out on the path of psychology in my in my junior college years. And just being able to listen to people, being able to help them. And as my career evolved and I got married and went back to college and graduated and up and moved to Miami, it just life has taken me and I've been very blessed to take risks where my husband is stable, I'm the risk taker. He supports it. We move around, and that's how I got to where I am today.
Uh-huh.
But I think the most rewarding thing is being able to make a difference in people's lives. Being able to, from the work perspective, being able to make changes that help people. When COVID hit, I had the opportunity to start a COVID testing clinic, to create a COVID vaccine clinic, in a very short amount of time. And the other piece to that is being able to mentor the
Okay.
people that I work with, right? And people need to be acknowledged for their skill set and their knowledge. It doesn't mean that they have to have a piece of paper behind it.
Mm-hmm.
It's if they have the will, and it's identifying those talents and that skill set and making somebody feel good about themselves and building them up so that they're ready for the next step in their career
Mm-hmm.
is very rewarding. And being able to do that and give back and to be able to help kids in school. I don't have children myself, but I love to see the evolution of children from, I've known some people and I've seen their kids for 21 years grow into young adults. But just being able to be there for someone and to also instill confidence in them to let them know you can do a lot with what you have and what you know. and seeing them grow is why I do what I do.
Oh. So you knew that you were going to either do this, be a social worker, or a lawyer.
I
But
worked in a law firm for one day.
so it wasn't going to work out.
No, not that path. Didn't want to do it.
So okay, what would you say to young Latinas or young women in general who want and see what you're doing there at Legacy and want to take that step to be able to accomplish as much as you've been able to accomplish?
I think one, you find your why, right? Why are you going down? Why do you want to do what you want to do?
Okay.
When you find and define your why, then the path is going to take you whichever way it will, right? And like I said, I started as an executive assistant, and then it evolved in the medical field, and then it just evolved into an operational role where I could make change, where I could look at things and fix them and work with teams to fix them. And true story, when I was in graduate school, I had a professor tell me, you will never be a vice president. You don't have the skill set, not the skill set, but just the fortitude to do that.
Mm-hmm.
And that kind of stuck with me for many years. And when this opportunity came up, I said, you know what, I'm just going to try it. And I did. And I got it, and that was very rewarding to say, just because somebody says no or that you can't doesn't mean that it holds true. As long as you continue to pursue and follow the why in life and not try to control, because not everything is going to be a straight path to where you want to get to. Trust me, it's taken a lot of curves, a lot of movement. But if you stay true to who you are and to what you believe and hold the confidence that you know what you're doing and you know what you know, regardless of how hard things get, of how many times you may get stripped down verbally, you you can get past that. It is a hard moment, but you learn from it and you grow.
Yeah.
And I like to do a self-reflection at the end of every day. What did you do today? What was your why? What was your purpose? And what could you do better tomorrow? And I think if you keep that mentality, you continue to grow, but you also continue to achieve what you work for.
Yeah. You know, I'm happy you said that because this is a really great opportunity to bring up this to the audience because I, throughout my life, have heard you can't, you can't, you can't. And I thought to myself, I can't, I can't, I can't. Little did I know, you're right, I can't. I'm not going to do it tomorrow. But you know what changes? People change. And I've
Mhm.
changed. And I can. And I did. And I am. And the process of that became this. Those who can, even in the moment, as they're being told you can do this, sometimes they don't want to. And we forget that too, is we see the potential in other people to want to do what they need to do, but because we want them to do it, not because they want to do it. So when you're continuously hearing, you can't, you can't, you can't, it sets in with you as part of your DNA sometimes. As
Mhm.
like, I'm not good enough. I'm not, I wasn't born talented. I wasn't, whatever. And everything gets in the way and we misconstrue what we are. And it's harder even when we hear it from teachers and instructors and people who
Mhm.
see us on a day basis. And I think to myself, well, no, I'm not gonna I'm obviously not gonna think I'm gonna get like an anchor rope. And not that I ever wanted to, but I
Yeah.
don't think I'm gonna walk in and be like, oh, here I am. Like, that's not the way this works. And I understand that. But, I want to tell the young Latinas who listen to this, and even those who are on their second wind of seeking out a second journey of career, what has been said in the past is not true today. As we can see, ebbs and flows and things change all the time. And so thank you, Stephanie, for bringing that up because It it does it hurts in the moment,
Oh,
and
yeah.
as we grow, um, we understand it was completely an insecurity of theirs from their lost potential, and it had nothing to do with you.
Yeah, because your mind is a very powerful tool, right? It
Yeah.
can tell you stories. It can fix stories in your head, like you said, and that stays with you. And I think what I've learned throughout the 15 plus years of doing this is, like you said, you will have those days where you have doubts. You will have those days where you are insecure. It's what you do with it to turn it around, right? And to not let the stories in your head dictate the road that you take in life, right?
Hmm.
At 23, I ran for city council and did it. It was flipped. It was 65-25, where the minority was 25. Impeached a mayor of 13 years. And I was 23. I didn't know. And I give my dad, who encouraged me to run and to become the first Latina city councilwoman in this little city of South Houston of 65,000. That was a really good foundation for me, because I
Hmm.
look back and I say I could not have done that had I not had some sort of confidence. And at the end of the 2 years, they were like, "Can you run for mayor?" And I was like, "No, I'm going to go back to school. I'm done."
My work here is done. I'm
But
gonna go
that
to
is, that is just a testament to, it's, life gets rough. You take different journeys in life. But at the end of the day, if you know what you're doing makes you happy, and it doesn't mean that you have to be a vice president somewhere. It doesn't mean that you have to be a CEO or COO. As long as you are a good steward of the community and doing what you know life has in store for you, will always, be your success. That's your story. And
Stewart. Mm.
I I would love, for anyone who's listening to this to just know, don't give up. You will get there.
Mm. You're a steward of the community. I love that. I love that. I love that a lot. That's it. That's the whole episode. That's the podcast itself.
That's
I,
it.
Stephanie, I'm going to ask you two questions because you're a busy woman, and I definitely want to give you back your time. So, two questions before I let you go. One, what advice would you give in general to young Latinas?
Pursue your dreams. Don't give up. Be proud of who you are and where you come from, and always remember where you come from, because that will be the vein of your existence. And the more you remember your upbringing, and whether it be good, bad, or indifferent, you've made it this far in life,
Mm,
you can make it a little bit further.
it's amazing. Again. Lastly, do you consider yourself a leader? Why or why not?
I do. I am not your textbook leader. Um,
Okay.
I think being able to lead is getting teams, whether it be good, bad, or indifferent, to do something. And I have found an ability to do that unknown to myself. Um, Two examples. One is, in my previous role, there was an assistant when I first walked in, and she was like, had gone through so many bosses per se, and I
Mm,
came in and she was done. She wasn't having it, and so I found a way to connect with her, and I found a way to build her up and let her know that she is more than just an assistant, right?
yeah.
And the same thing here in my new role. There were two very talented young ladies that I recognized their talents, and when the opportunity came up, promoted them. And when I tell you they are amazing, they are amazing.
Mm,
And being able to lead is being humble, is being able to recognize talent, is not being insecure in your role and leading top to bottom, but it's bringing people along with you and helping them grow and
mhm.
develop, so that when I go into retirement, there are people ready to do what I do, right?
Yeah.
And I can go on vacation and know everything is fine because they are empowered to do their job. I don't need to be here to tell them what to do.
Mm-hmm.
I'm here to support and to help them grow and to get through hard times. And we underwent a major change this last year. And for the team that I have remaining to be so resilient and to rebound the way they did, just tells me we helped them get through that tough time. They're still with us. And so caring about people is my way of leadership, caring and growing and empowering people and not making people feel like I'm the boss and you're the employee. No, we're all in this together. And I think when we can get through those times and see people grow, see people develop, then you know you've led them down the right path.
Stephanie, I think you've given so much to this podcast today. I am forever grateful for the conversation and the opportunity to talk to you. Gracias.
Thank you
so much.
I appreciate it and thank you.
Thank you for joining us on the Latina Leadership Podcast. If you enjoyed today's episode, be sure to like, subscribe, and share it with your amigas, comadres, hermanas, your mom, your tias, or anyone who you think would enjoy the conversation. The Latina Leadership Podcast is a weekly video and audio podcast since 2020. Visit our online Latina Leaders Directory, join our growing community of Latina changemakers, keep up with our calendar of events, or reach out to us if you're interested in supporting the Latina Leadership Podcast by visiting our website at latinaleadershippodcast.com. And with that, we'll see you next time.